Hello friends, this is Dr. Saurabh Patwardhan from Nandadeep Eye Hospital PG Teaching Institute, and in this vlog I am going to speak about a patient 50-year-old who presented to us for refractive surgery. So patient wanted to get rid of glasses. Patient was hyperopic plus 2 diopters and there was recent change in the glasses, and when we checked, patient had started early cataract changes. As you can see here, there are cortical spikes. Also patient has developed grade 1 nuclear sclerosis, so we decided to go ahead with cataract extraction, which will take care of the glasses as well. So this is a refractive cataract surgery. I have taken an incision on the steep axis. As you can see, in younger patient we tend to have more chances of with the rule astigmatism, so we have to take the incision in the superior axis, and the capsular axis has to be good enough. You should avoid too eccentric or too small capsular axis in these cases. Good hydrodissection. This is a grade 1 cataract, soft one, and I'm going to show you how to do a primary chop in case of soft cataract, which is a bit difficult to begin with, but once you get good hold of your machine and your hand control, you can do it. Now just watch here, 70 centimeter is the bottle height. I have kept longitudinal power of 70% with 10 pulses per second, and here it goes. See the line of attack to the center of the nucleus, and then the chopper comes in. This is a 1 millimeter long Sinski, so it doesn't have any sharp tip, it doesn't have any blunt or ball like tip, so it can pierce in the nucleus quite easily. Just watch once more, line of attack to the center of the nucleus. The Sinski comes down to the center and then splits the nucleus in two halves. The same maneuver is repeated to divide each heminucleus into further 2 divisions so that you can take out the pieces comfortably. Now going to the quadrant removal mode. Here I am going to use 100% Ozil in the linear mode. I have raised the IOP to 100 centimeters and also raised the vacuum so that I can finish off the quadrant removal quickly and safely. You can see the AC is quite stable, no fluctuations noted in the posterior capsule, so even for the last piece I am not going to change the parameters. That's pretty much end of the emulsification, so cortex removal remains. Now I am going to use here a refractive EDOF IOL, Lucidis. It has an addition of +3 diopters at the spectacle plane, so it's more of a refractive trifocal, I would say, that the technology is slightly different than the diffractive trifocals where you see the rings on the IOL. Here you will see only a central bump and then there is gradual reduction in the power to the periphery. I am using 1% hyaluronate to insert the IOL in the bag, and then I am going to rotate it horizontally so that I can take out the viscoelastic beneath it. It's a very good IOL with good post-operative outcomes, quite stable refractive outcomes. The glares and halos are not complained by the patient frequently. It has good contrast sensitivity, though of course for reading small prints we recommend to have good amount of light. This is a good option for those who want to drive occasionally at night because the halos and glares are less as compared to the diffractive trifocals that we use. So that's the end of the procedure. You can see well centered IOL. You can see the Purkinje images of the microscope falling right in the central area of the bump, indicating that patient has good centration of the IOL. So always check out that patient doesn't have very high angle alpha, and this is a good IOL to go for. For more such videos, do subscribe to my YouTube channel. Thank you.